Welcome to our guide on overcoming anxiety and post-traumatic stress syndrome, also known as PTSD. Our journey begins with understanding these two distinct yet interconnected mental health challenges. Anxiety, in its simplest form, is a natural response to stress. It's that feeling of fear or apprehension about what's to come. Perhaps it's an upcoming job interview, a first date, or even just the prospect of speaking in public. These situations can stir up feelings of unease, and that's perfectly normal. However, when these feelings of fear or apprehension become a regular part of your life, to the point where they're out of proportion with the situation at hand, it's possible that you might be dealing with an anxiety disorder. On the other hand, we have post-traumatic stress disorder, or PTSD. This is a psychiatric condition that can occur following the experience or witnessing of life-threatening events such as military combat, natural disasters, terrorist incidents, serious accidents, or violent personal assaults. It's not just about feeling stressed or upset about these events, but rather, PTSD involves specific symptoms that last for more than a month and cause significant problems in social or work situations and in relationships. So how do we differentiate between the two? The key difference lies in the triggers. General anxiety can be triggered by almost anything, and the person suffering may not even know what's causing it. PTSD, however, is directly related to traumatic events, and the individual can pinpoint what's causing their distress. It's important to remember that these definitions aren't a diagnosis. They're a starting point, a way to understand what you or someone else might be experiencing. If you feel that you're struggling with anxiety or PTSD, it's crucial to reach out to a healthcare professional who can provide a proper diagnosis and guide you towards the path of healing. Anxiety is a natural response to stress, while PTSD occurs due to traumatic experiences. Both can be challenging, but with understanding and the right help, overcoming these obstacles is possible. Recognizing the signs of these conditions is the first step toward healing. Let's delve into what these signs might look like. Anxiety and PTSD, although related, present with distinct symptoms. Let's start with anxiety. The physical signs can be quite telling. These may include a racing heart, rapid breathing, and restlessness. Emotionally, people grappling with anxiety might find themselves constantly worried or feeling a sense of impending doom. They may have trouble concentrating, struggle with sleep, or experience fatigue. Now let's talk about the signs of PTSD. They can be categorized into four main areas. First, we have intrusive thoughts such as repeated involuntary memories, distressing dreams, or even flashbacks of the traumatic event. Next, we have avoidance behaviors. Individuals might steer clear of people, places, activities, objects, or situations that remind them of the traumatic event. This avoidance could be physical or even emotional, like trying to avoid thinking or talking about the event. Thirdly, we have alterations in cognition and mood. This could manifest as negative thoughts about oneself or the world, or distorted feelings like guilt or blame. There might be a loss of interest in previously enjoyed activities. Lastly, we have alterations in arousal and reactivity. This could mean being irritable or having angry outbursts, behaving recklessly or in a self-destructive way, being easily startled, or having problems with concentration or sleep. It's important to note that these symptoms can vary from person to person, and they might not appear immediately after the traumatic event. They may surface weeks, months, or even years later. If you or someone you know exhibits these signs, it may be time to seek professional help. Remember, there's no shame in reaching out. Mental health matters, and seeking help is a sign of strength. In the next scene, we'll discuss the therapies available for managing and overcoming these conditions. Stay tuned. Fortunately, there are various therapies available for those struggling with anxiety and PTSD. Let's delve into the world of healing, where psychotherapy and medication take the lead. Psychotherapy, also known as talk therapy, is a way to help people with a broad variety of mental illnesses and emotional difficulties. This therapy aims to eliminate or control troubling symptoms so individuals can function better. It can be a one-time intervention or a long-term treatment plan, offering relief from symptoms and improving quality of life. Then there's medication. Medications are often used in conjunction with psychotherapy and can play a crucial role in treatment. They can help manage overwhelming symptoms of anxiety and PTSD so that individuals can engage more effectively in therapy, But among these therapies, one method stands out as particularly effective for both anxiety and PTSD: cognitive behavioral therapy, or CBT. This is a type of psychotherapy that helps people recognize and change thought patterns that lead to harmful behaviors or emotional distress. In CBT, individuals work with a mental health counselor in a structured way, attending a limited number of sessions. It helps individuals become aware of inaccurate or negative thinking, so they can view challenging situations more clearly and respond to them in a more effective way. CBT can be a very helpful tool in treating mental health disorders, such as anxiety and PTSD, where it can provide a new way to understand and manage symptoms. It's not a cure-all, but it equips individuals with the skills and strategies necessary to manage their symptoms and cope with future challenges. To sum it up, therapies like psychotherapy, medication, and especially cognitive behavioral therapy can be a beacon of hope for those living with anxiety and PTSD. It's a journey of healing, of reclaiming control over one's life. With the right therapy, individuals can manage their symptoms and reclaim their lives. Remember, the journey to wellness is not a race, but a path that is unique to each individual. It's okay to take one step at a time as long as you keep going. Family and friends play a crucial role in the journey toward overcoming anxiety and PTSD. Their support, understanding, and patience can provide the emotional scaffolding on which recovery can be built. Mental health is not a solitary journey, but a communal effort that requires the active participation of those closest to us. Imagine a garden where each plant represents an individual's mental health. Some plants are in full bloom, while others may be wilting under the weight of anxiety or PTSD. As friends and family, we are the gardeners, providing the necessary care and nurturing for these plants to grow and thrive. A supportive environment is the sunlight that helps the plants grow. It involves creating a safe space where loved ones feel comfortable sharing their experiences without fear of judgment or misunderstanding. It's about acknowledging their struggles, validating their feelings, and affirming their worth. In the same vein, patience is the water that sustains the plants. Overcoming mental health conditions like anxiety and PTSD is not a race, but a lifelong journey. Progress may be slow and setbacks may occur, but with patience we can help our loved ones navigate through the ups and downs. Lastly, we can act as the soil, grounding and nourishing our loved ones by encouraging them to seek professional help. While we can provide emotional support, it's important to recognize when professional intervention is needed. Therapists, counselors, and psychiatrists are equipped with the necessary tools and expertise to help manage and treat these conditions. In essence, the role of friends and family is to act as the sunlight, the water, and the soil, fostering a nurturing environment that facilitates growth and healing. As we support our loved ones, we not only help them in their journey towards overcoming anxiety and PTSD, but we also contribute to the cultivation of a more compassionate and understanding society. Listening, being patient, and encouraging loved ones to seek professional help are vital steps. It's a powerful testament to the human spirit that even in the face of adversity, we can come together to foster healing and resilience. Overcoming anxiety and PTSD is a journey, not a race. It's a path that unfolds differently for every individual, shaped by their unique experiences, strengths, and challenges. This journey is often marked by peaks and valleys, but remember, every step forward, no matter how small, is progress. In this journey, seeking professional help is not a detour or a roadblock. It's a bridge. It's a bridge that connects you to resources, strategies, and understanding. It's a bridge that can lead to healing and recovery. Professional help comes in many forms. It could be a psychiatrist who can guide you through medication options, or a psychologist who specializes in therapeutic approaches like cognitive behavioral therapy. It could be a counselor or a social worker who provides emotional support and practical advice. It could even be a support group where you can share experiences and learn from others who are on a similar journey. The key is to find what works best for you. What helps you feel seen, heard, and understood. What equips you to navigate your journey with confidence and resilience? And remember, it's perfectly okay to try a few different options before you find the right fit. Now, reaching out to these professionals might feel like a big step. It might feel intimidating or overwhelming. But remember, you don't have to take this step alone. You can ask a trusted friend or family member to help you make the call or even accompany you to the appointment. You can take your time, move at your own pace, and celebrate every step forward. If you're ready to seek professional help, there are many resources available. These include the National Alliance on Mental Illness, Mental Health America, and the American Psychological Association. Their websites provide directories of mental health professionals, as well as guides on how to choose a provider that's right for you. Thank you for watching. Remember, it's okay not to be okay, and seeking help is a sign of strength. You are not alone in this journey, and with the right support, you can navigate the path toward healing and recovery.